Antoinette Valle. I'm an outreach and enrollment specialist here at the Family Health Clinic. For our 25th anniversary, we're interviewing staff and community members to explore what the Family Health Clinic means to them. In this video, we have Jessica Skinner, a behavioral health specialist here at the Family Health Clinic. Jessica, why don't you introduce yourself?
Hello there. I'm Jessica Skinner. I'm one of our social workers here with the health clinic. Been here doing social work for about 3 years now, and very, very thankful to be a part of the clinic and all that it has to offer.
Thank you, Jessica. How have you seen the Family Health Clinic grow in the community since you first started?
When I first started, it was actually about 8 years ago. So been able to see the growth. When I first started, we just had 2 clinics, the one in Delphi and then the one in Monon. So over the last 8 years, we've grown with our clinic in Wolcott and our clinic in Burlington. And between yourself and Barb Hickner, just the amount of community events and that we've been able to be a part of has been very cool to see, because before Barb, or before you were here as well too, we didn't have a whole lot of that, and it was a real struggle to try to get people out, get people really involved. And so the more and more that we have been involved in just different community events, from fairs to open houses to just job fairs, just all kinds of different things that you guys have been able to be a part of and have been able to kind of include all of the rest of us and coming out. It's been very cool to see. And so we've grown with our staff, we've grown with our patients, and it's been a really cool thing to see, just the amount of lives that have been touched because of the growth at the clinic.
Yes, I agree. What are some ways you have seen the Family Health Clinic impact our community?
Some of the ways that I have seen the clinic impact our community, we have been able to be a part of some different things as far as things that have happened in the community. We've been a part of just anything that's kind of gone on. We've had some things that have happened, good and bad, in our community. And from social work side, we've been able to kind of come in and help patients with whether it's been grief and loss, whether it's been devastations and tragedies. The clinic has, from social work standpoint, been able to come in and support people through that. We've been able to impact people by connecting them to resources, hooking them up with whatever that they may need, and giving them a path, giving them a direction to go and helping to see, to facilitate some of that change. And so that's been really cool to see, and the impact that we've had on the community. The more that we've continued to grow, the more that the community has seen the things that we are able to do, we are able to help with. And so we've continued just to make that part of our mission, and providing patients with that care and that just consistency throughout the time that I've been here, and throughout the last 25 years, we've always been here. And so I feel like we've done a really good job, as best as we can, to kind of impact and make a difference in our communities.
Yes, that's for sure. What does being part of the Family Health Clinic mean to you?
Ooh, what does it mean to me? What it means to me is the fact that I have coworkers that are my friends. I have people that I adore seeing. It makes my heart happy when I get to be around them. With the clinic growth, we haven't always been able to see a lot of people as much anymore like we used to. And so just being part of that family, being part of that team, we all have the same ideas. And I mean, as far as like with our patients, we truly care. We want to provide, the best quality that we can, and having that empathy and that understanding with all of our, employees and our staff has been so cool. And so I'm just so thankful to be a part of this, because we're such a great team together. And we all know that it takes all of us to make things happen, from our nurse practitioners to our pharmacy to our outreach coordinators and insurance navigators and, social work. There's all kinds of things, and we work so well together as a team. So I think the biggest thing to me is just that family, just having that additional support and just loving every day the fact that, when I get to go to work, like, I love seeing the people that I work with. Like, I'm very happy and very thankful. And I think that so much starts from, our administration, and, they really look for people that have that good fit with us, that have those same kind of ideas and values and standards. And so I think our administration has done an amazing job of hiring, the right person, excuse me, a right person for the job. And it's been amazing just having that family aspect. So I think for me, it's just that additional, that additional family is what that means to me.
Awesome. What is one thing you want the community to know about the Family Health Clinic?
One thing I want the community to know about the Family Health Clinic, that's a good question. That we're here, that we're available, that it doesn't matter who that you are, where that you've been in your life. Things have happened, good paths, bad paths, wherever that you've been at in your life. We're here. We don't, there's no judgment. There's no anything like that. Again, we kind of come together, and we don't care who you are. We want to make sure that we take care of our patients, because they're our patients, and we want to help in any way that we can. So no matter what stage of life you're in, no matter where you're at in your life, that we have the ability to come in and just meet you where you're at and help in any way that we can, and connect to resources, connect to different things, medical to behavioral health, and just that we have so much to offer. And the fact that we're here, well, we're local, we're in 4 different small communities. We want to be there for our community, and we want to be here for our patients. And so, I think that's the biggest thing that I want people to know, is that we're here, and we're here to support and be a part of their life and their health and wellness in any way that we can.
Yes. Well, Jessica Skinner, thank you so much for your time and involvement with the Family Health Clinic.
Well, thank you. And thank you for your time. Thank you for all that you guys are doing. We so appreciate you. I know it's probably a thankless job at times as well, too. And so we appreciate all the effort that you guys put into it as well, too.
Thank you very much.
All right. Thank you.